of this afternoon's event. We are streaming this event live on Facebook. We've just started streaming, so hello to folks that are joining us there. Oh, it looks like some folks may not be able to hear me. Sorry, hold on one second. Okay. Okay, so some folks can hear, it looks like. Some folks cannot. Okay, so folks who can hear, great. So folks who can hear, great, I hear you. You can, we can pause that messaging just so if anybody cannot hear, we're gonna troubleshoot through the chat. Thank you, Kim. So just follow the instructions in the chat if you're having trouble hearing. Hi, everyone. Hi, everyone, to those who are joining us on Facebook. We're really excited to have you as well. Please do put any questions or comments that you may have on the Facebook live stream so that we can get forward those to the speaker. We are going to be having a Q&A portion at the end of the presentation. So we are going to hold all questions until the end, but we're really excited to be able to take those questions and keep them as we go. As I was saying, NAMI-NYC, the National Alliance on Mental Illness of New York City, is the host of this event. Our mission is to provide support, education, and advocacy for all individuals and families impacted by mental illness. We provide free classes and support groups and other services for people who are dealing with mental health issues themselves, or anybody who is supporting somebody who is dealing with a mental health issue, whether that's a family member or friend or loved one. You can find out about all of our support groups and services, which are offered free of charge, by going to our website at NAMI-NYC.org, and we're going to put that link in the chat very shortly. Or by calling our helpline, which is available from 10 a.m. to 6 p.m. Monday through Friday at 212-684-3264, or at helpline@NAMI-NYC.org. And we're going to put that information in the chat as well. I think that is the extent of our, I'm sure there will be other logistical things that come up, and I will be moderating and keeping track of any questions in the chat. So do feel free to converse and discuss and respond in the chat. We hope to have a lively conversation there as well, and I will be keeping track of any questions that come up to ask our speaker at the end. Okay, so with that, I am going to turn it over to our speaker, Dr. Klein. We're really excited to have her here today, and we're really excited to have her.
All right. Should I take it from here, Clara?
It is all you. Thank you.
All right. Well, thank you so much for inviting me. I'm thrilled to talk to such a big audience. It's so weird to be on Zoom because it always feels the same no matter how many people you're talking with, but this is really exciting. Thank you for having me. My name is Emily Kline. I'm a clinical psychologist. I work in a psychosis treatment program. I'm the director of psychological services for that program at Boston Medical Center, and I'm an assistant professor at Boston University. And one thing that I love doing most of all is working with families of people who are experiencing mental illness. And I'll tell you a little bit about my work and about some things that I hope can help you all today. So as I said, I'm a psychologist. I practice, I do research. I work in a big hospital in Boston. And I want to tell you about something called motivational interviewing today. I didn't invent it. It's old news, but it's something I learned in graduate school. And since then, I found, over the years that I've been practicing, it's always the best tool in my toolbox, almost always. I find it so, so helpful. And it's a way of communicating that I'm going to share with you today. And what I've been able to do for the past 2 years is really to devote most of my time to figuring out how parents and other loved ones, family members, partners, friends, can learn these communication tools to have better conversations with each other, and especially with people who may be struggling with a mental illness, to talk about things large and small, and have better relationships. So I've had funding to develop this content from the Massachusetts Department of Mental Health and from the National Institute of Mental Health. And I don't have any commercial interests. So I want to start with the concept of insight, because I know this is really important for families who are dealing with mental illness. Insight is a clinical term, refers to the recognition of one's own illness, that something is off, basically. And poor insight is a hallmark of the acute stages of psychosis. People may be acting very, very differently. They may be preoccupied with things that they would never normally be thinking about, but they feel like there's no problem with them. The problem is out there. I want to introduce the concept that I see insight as a spectrum, not a switch. And by that, I mean, it's not like you have insight or you don't. We can have more insight, move up the gradient on insight, move down the gradient on insight. And frankly, we all have wavering insight into our everyday problems. Sometimes I'm in a bad mood and I don't know why exactly I'm in a bad mood. And if you were to ask me, Emily, are you in a bad mood? I would say, no, go away. So we all struggle with insight sometimes, and insight can change from moment to moment. So for a lot of families, though, they're dealing with an extreme version of insight loss. And for both practitioners and for family members, it can really be a struggle to answer the question, well, why would someone who doesn't have any insight into their problem want our help? I want to show you all a little video to illustrate this concept that I really love. It's by a writer named Jason Headley, who's been so great about allowing me to share this in my work. And he is also the actor, the male actor in this video, just so you know. So I'm going to stop sharing my slides and I'm going to share a video with you, and hopefully that'll all go smoothly.
It's just, there's all this pressure, and sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail.
See, you're not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. All of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
Don't.
try to take things my way.
All right, so I'm gonna go back to sharing my slides. So we can talk about that, but I can't look at the chat. It's too much for my brain to be going through my slides and look at the chat at once. I'll get distracted, but if you have any reactions you want to share or questions, please go ahead and drop that in the chat. And you all can talk amongst yourselves, and Clara can bring some questions to me at the end of the presentation. So I want to ask you all a question though about this video. And the question I want to ask you is, do you think that the woman in this video has insight? So go ahead, it should pop up on your screen, a poll, and I want you all to just take a moment to answer my question, whether you think she has insight. All right, a lot of votes coming in. All right, I'm going to end the poll and I'm going to share the results with you all. So you all were pretty split, but a plurality of no's. So if you want to, go ahead and drop in the chat why you answered what you did. But I'll take a guess at why people may have thought she did or didn't have insight. Some people may have said, no, she doesn't have insight because she's not aware there's a nail sticking out of her head, like obviously. Some people might have said, yes, she does have insight because she's aware that something's wrong. Her sweaters are all getting ripped and she has a big headache. And some people may not have been sure because both of those things are true, right? She knows that she's having a problem, but she's not aware of a certain piece of it, which is the nail in the head. So, let me advance my slide here. So I kind of agree with the folks who are not sure. I find myself somewhere in the middle on that question that, she is aware to some extent of the problem that she's having, but she may not see it the same way that others do. I want to go back to the point I made before that insight isn't fixed. And I think this video illustrates that nicely. How we talk about the problem can influence the insight someone has into their problem. So if someone's feeling attacked or criticized, they may go on the road toward worse insight in that moment because they feel like they have to defend their point of view. Like she said, you're not even listening. But if someone's feeling heard and respected, they actually may move toward better insight. They may be open to others' input and interpretations in a way that they wouldn't be if they were feeling defensive. So that's what brings me to the idea of motivational interviewing. And I'm going to refer to this as MI because it's kind of a mouthful. So MI is a communication style that has been widely used since the 1990s by health professionals to talk to people about making healthy changes in their life. There's a ton of research on MI showing that it works pretty well. And it was developed with the goal of increasing motivation for treatment among people with substance use disorders. Now, people with substance use disorders, they may not have loss of insight in the classic sense that we mean when we talk about psychosis, but they may not be that motivated to change their behavior. And things that seem obvious to other people may not be clear to them at all. So it was developed in that context, but I've also found it helpful in the context of psychosis. And it's really based on the idea that the best way to influence someone else's behavior is not by necessarily being confrontational or giving them a lot of information and advice, but rather by respecting their independence and showing interest in their ideas and creating the space for them to explore their own motivation for change. So a lot of families have been interested in learning this in the couple of years that I've been developing this and testing it out because they're struggling. Putting their foot down is not getting the result that they want. And if you've ever attended Al-Anon, you know that we can't control other people, right? The best we can do is try new behaviors to keep our own side of the street clean, and we can feel good about that. And so this is kind of a version of that. MI for Loved Ones is a curriculum I've developed that teaches motivational interviewing basics that are relevant for families and can be used in an everyday conversational context. So I'm going to kind of give you the basics here. The first thing I want to say is that it's okay to want to give someone advice or tell them what's wrong, right? I mean, when we watch this video, I think most of us feel a lot of sympathy for this poor guy. He's just trying to help her, right? And he's not giving her bad advice or talking down to her or anything like that. He's just genuinely trying to help. When we see someone who we love and care about struggling, we want to help them because we love them and we're not bad people. Often that help or that effort to help comes in the form of giving advice or just jumping in and trying to fix the problem ourselves, or even trying to reassure them that what they see as a problem is not really a big deal at all and they should just relax about it. But for some reason, people don't like that, right? Not always. Sometimes advice is a gift, and that's where I'm going with this. But a lot of the times when we try and give people advice or help fix their problems, for some reason they react just like this woman and they say, wow, you're not even listening to me. You're so unhelpful. And they feel criticized or judged. I want to give that a name so that you all can maybe recognize yourselves doing it in your life or recognize other people doing it. Again, there's nothing wrong with it. It comes out of a place of love and caring. We call it the righting reflex, that impulse to want to help somebody and fix their problem. And for a lot of us, it's very, very strong, especially with people in your own family who you care so much about. So the righting reflex, I can't emphasize this enough, is not mean that you're being mean, does not mean that you're being critical, but it might mean that you sound a little bit like this. I want to set an audio clip up for you a little bit. You see this young woman here thinking about dancing. So this woman is my colleague, Simone, who's developed a lot of this content with me. And one of the teaching tools that we use is something called a real play. So in order to help people practice these skills that they're learning, we disclose a real life dilemma that we're having. And we ask them to help us think it through. And as they learn more skills, they're able to put those skills into use during these real plays. So what you're going to hear right now is a parent who enrolled in one of our programs who was talking to Simone, and the dilemma that Simone described, you'll hear in a minute, is about wanting to be a dancer and feeling stuck. And you can hear this very sweet, caring, brave mom's best effort to talk to Simone about her dilemma. So let me set this clip up for you. And it's about 2 minutes long. Here we go.
So my situation is that I am hoping to get back into dancing. I want to audition for a local dance company next month, but I have some reservations about it. I've danced my entire life, and that itself has been really positive for me, but the social atmosphere that kind of comes along with jumping into unfamiliar dance environments has been both positive and negative for me in the past. And these experiences have made me distance myself from dance, even though I love it and do miss it. So I'd say like I do really like going with friends, which that has been positive in the past, finding someone to go with me. But I would like to not have to necessarily rely on another person to go. But it seems like that is kind of something that's gonna ultimately make me end up going. But that's where I'm at.
All right. Well, I think it's great that you're gonna start doing dance again. That's really wonderful because you're so good at it. And I would just recommend you're always gonna come upon people that are different. Sometimes if you just burst on through, the first day and even if you're scared, just keep going. Think of the way it makes you feel when you're dancing. And that would be, and hopefully as you're plowing through, it will take away any insecurities, by facing it straight on.
Yeah, I think that I think it's just a matter of, I don't know. I just don't have the motivation. Like, I'm motivated to go, but one, there's a pandemic, so I can't do anything right now. It seems like, but two, I feel so strongly about all of this stuff that I've encountered before that I just don't even know how I could even get to the point where I can go.
All right. So I just want to say thank you to that parent who was so great and gave us permission to use her audio for teaching and sharing. So what I hear when I listen to that clip is a mom who's being really, really positive, like, you can do it, just go for it, kind of giving her a pep talk, right? But for some reason, Simone doesn't match her enthusiasm. What you hear in response is kind of this, a lot of butting, like, but I can't do this, and I don't know about this. And it actually seems like she moves away from indecision to me. But I want to know what you all think. I'm going to launch a quick poll to see what you all think. Do you think that Simone is going to sign up for dance class after this conversation? All right. So thanks for answering the question. There's still some answers coming in, but it's about 9-1 for the no's. Most of you think she's unlikely to sign up for dance class. And if you want to elaborate or debate each other in the poll about your answer, definitely go for it. I mean, in the chat, excuse me. So, all right. So I like that clip because to me, it really shows a mom who's leaning on her writing reflex, right? She's just like, let me just give you some advice. Let me give you a pep talk. Let me make you feel good. And hopefully that will solve your problem that you're having. And sometimes that works, right? I'm sure you've all had success with that in certain situations, but a lot of the times it doesn't. And so motivational interviewing is kind of a different approach to get there. The basic idea here is that in order to consider a healthy choice or a change, which is scary, people need to feel understood, confident, and in control. So most of us are a little bit ambivalent about most of the changes we make in our life, even if we end up going for them, right? But when we talk to someone and you're feeling ambivalent, it really helps if they really take the time to understand your perspective, if you feel like they believe in you, and if they don't want to push you toward a certain decision, if they make sure that even if they're giving advice, they're recognizing that you're going to make the decision because it's your decision to make. So what we teach, that's kind of abstract, right? What we teach parents in our program is some really concrete tools to do that. So we try and teach parents a couple of skills that I'm going to share with you and a couple that I can't get in this hour to build that understanding, confidence, and autonomy in conversations with their family members. And I keep saying parents, but I really just mean family members because we've had a number of step parents, grandparents, foster parents, and siblings participate in this course as well. So the first tool that we give people is reflections. The idea of a reflection is to hold up a mirror to someone and convey empathy and careful listening. A reflection is a statement, not a question. It's important that your voice kind of goes down when you do it. And it has to be specific, not generic. You can't just say, I hear you. What you do is you reflect back what you heard the person say, or you take a guess at what they might be feeling or what they might really mean. And you offer that to them instead of necessarily sharing your perspective right away. And what it does is it slows down the conversation. I'm not telling people, never offer your opinion, but first maybe go with the reflection to make sure that the other person in the conversation is feeling understood. And it helps other people to feel accepted, and it helps them to hear their own words echoed back to them and think a little deeper about whether they really meant that. And it also allows them to clarify any misunderstandings or exaggerations. Maybe if you say, wow, I'll get into some examples in a minute, but you might offer a reflection and it's a good reflection, and it gives the other person the chance to say, well, I didn't really mean that. So that can actually be the outcome of a very good reflection. An important point about reflections is that they don't judge. So they're different from praise. There's nothing wrong with praise, but praise is just something different. Praise evaluates whether someone met expectations. And reflections don't. And reflections also don't say whether you agree or disagree. You can save that for later in the conversation. You should absolutely tell someone what you think if you disagree with them. But an important part of this kind of communication is that first you listen and reflect. As we get older, we appreciate non-evaluative comments. And let me give you an example. If a good friend of yours got a new job or made you a delicious dinner, you wouldn't give them praise. You wouldn't say like, good job. It kind of puts you in the position like you're evaluating them. You might express admiration or appreciation instead, like, wow, you really worked hard for that, or I'm so proud of you, or thank you, I appreciate this. So that's just how reflections are a little bit different from praise. Here's some examples just to make this a little more concrete. Say you're having a conversation with a loved one and you start veering into an argument about marijuana. Where I live, it's fully legal. So this is very, very common. If your loved one says, well, all my friends do it, it's really not a big deal. Just get off my back, okay? You might be tempted to get into debate over the merits of that statement, right? But offering a reflection is a way of just slowing down and expressing interest and acceptance of their perspective. So you could say, okay, so smoking weed seems normal to you. Or you feel like I'm making a big deal out of nothing. Or my concerns are annoying to you. And you hear how my voice goes down, right? I don't say, so smoking weed seems normal to you, because that's more confrontational. It's like, I hear you, I'm listening, I'm processing. Here's another set of examples. If somebody doesn't want to take medication and they say, well, medication makes me stupid, it's bad for my brain. Again, instead of getting into the merits of that, or whether you agree or disagree or what the doctor thinks or whatever, you could slow down and do a reflection. Okay, so it makes you feel stupid, or you had problems thinking clearly when you tried it before, or so you don't think medication can help you. It's a weird way of talking, and people feel very self-conscious when they try it. But I really encourage you to give it a shot with someone in your life, and just see what happens, because most people really appreciate a good reflection and it gets them talking more. So I want to give you a chance to practice before you go do this in your life. So try typing a reflection into the chat if you want to give it a shot for this statement. My medication is none of your business. Okay, I'm looking at the chat. So these are really good. So you'd rather have some privacy about this topic. You want control over your medication. Sounds like you want to handle it yourself. I see some questions, and just to clarify, a question is a little bit different from a reflection, and I'm going to talk about questions next. So thanks for putting those in the chat. And I also happened to see a comment about the great book, I'm Not Sick, I Don't Need Help, which I really highly recommend. And it's just a great resource. Yeah, and a lot of, I read that book. I like that book. I think our advice is very similar. Okay, so the other tool I want to tell you about is asking curious questions. It would be weird if all you did was just reflect. But a key to good communication is to really ask questions from a place of curiosity and to get very curious about another person's perspective and values. So curious questions are not, they're not interrogating questions. They're not Socratic questions. You're not trying to teach somebody or something or prove a point to them. You're really getting curious. You just want to know what they think. And it's hard to cultivate that curiosity about your family member, right? Because you think you know everything about them. And you have to kind of put yourself out there to really be curious and ask open-ended questions to a family member, because it's not how we usually communicate with the people closest to us in our lives. But again, I challenge you to just give it a try and see what happens. So here's some question examples. Say someone says, I'm not going to see that doctor again. No way. Again, instead of getting into an argument about that, you could get curious. So here's some good curious questions you could ask. What happened last time you met with her? Or help me understand where you're coming from. Or what do you see as the pros and cons of meeting with that doctor again? It's really hard to get into a practice of trying to turn some closed questions into open questions. And again, I use closed questions too. I'm not saying there's anything bad about them, but it's a challenge you can give yourself to try and come up with open-ended questions where you might normally ask a closed question. So a closed question is a question that has like a one-word answer and maybe a right answer, whereas an open-ended question doesn't have a right answer. It's curious and it can't be answered in a single word. So here's an example. Instead of asking, are you feeling better today? Which has kind of a yes or no answer, you could say, what did you do today? You know, try and get the person talking a little bit more. Instead of saying, did you take your medications? A more open-ended phrasing, what's going on with medication? Instead of asking, are you going to that therapy appointment? You could ask, how has therapy been lately? Or what do you see as the pros and cons of meeting with that therapist? So again, if you want to take a minute to practice, I'll look over at the chat and you all can think of a question you might have. If someone in your life said, I am not going to Aunt Patty's wedding, what might you ask that would be a curious, open-ended question? Help me understand. Great. What do you think will happen if you go? Awesome. How do you get along with Aunt Patty? That's great. Is there any particular reason why? What's behind that? These are perfect. Great job. All right. Thanks for sharing those ideas. So a lot of you have this concept of curious questions. And again, give it a try. Next time you feel tempted, you know, someone says something that you find a little bit like, where's that coming from? Rather than arguing, try just asking it from a place of curiosity. So I want to show you how just reflections and curious questions can really change a conversation. I'm going to play another audio clip. And this time, Simone's talking to a parent who's completed the motivational interviewing course in my program. And she does a beautiful job of using just these two skills, and the conversation goes very, very differently. It's a different parent, but Simone has set it up the exact same way. She's given the same spiel about how she wants to dance, but she's feeling stuck and hasn't been going for a long time. So instead of this parent giving advice or encouragement, she says, okay, well, tell me more about why you quit dancing. And you can hear what happens next. So again, this is about 2 minutes long.
It was like, I'm growing up. I don't like my body as much as I used to. It doesn't do what it used to do. And then, you know, like I don't get to dance anymore anyway because of all the issues. So I'm quitting that entire part of my life unwillingly, but for myself and for my own mental health. But then, you know, I couldn't find a way back in.
Yeah, no, this sounds really, really important to you, to both, you know, your physicality, your body, and also, you know, just the emotional experience of being close to people and close to people who are as serious as you are. That is what I'm hearing, and structure as well.
Yeah, I'd say you hit all of them. Perfect, spot on.
Yeah. So what do you think that you could do?
I honestly don't know. I've had this conversation before, and I think I really was like very passionate about that dance piece. But now I'm wondering if I can, kind of thinking about those fundamental things that I care about, like structure, seriousness, kindness. I'm wondering if I can find an active group-based thing that allows me to get all of those things met, but maybe it doesn't have to be dance. And I mean, I do love dancing, but I also, I don't know, maybe that chapter kind of is closed for me. And maybe that's why I'm having such an issue getting kind of started back up with it, just because maybe I should just move to kickboxing. It's like a structured thing with the teacher that's going to be kind of encouraging us. And I'm sure that the people around me will be doing the same. So, and I'll be able to form relationships and meet people. Maybe I should look into that. I'm actually looking that up right now.
That's so great. Oh, that's exciting to hear.
Yeah,
that really is.
Thank you. That was really helpful.
All right. So did anybody catch the open-ended question? The one I didn't play was when she said, tell me more about this problem. But there was a great open-ended question in there. I'm curious if anybody caught it. Why don't you like dancing anymore? Yeah, that was great. And she said, what could you do? Yes, that's right. So a couple of people are typing that. Yes. What could you do? What could you do? Rather than giving advice, she said, what could you do? And asked Simone if she had thought of any solutions on her own or might think of any in the moment. And again, this parent may have had great advice to give. And if Simone seems stuck, she might offer that. But it was a lovely move to ask, well, what could you do? Because it made it so that Simone might come up with the solution to her own problem. So I'm going to stop the share for a second and do another poll. So what do you all think from the tone of the conversation there? Do you think Simone's going to try something new, move toward change and growth from this conversation? Okay, great. A lot of answers coming in. The vast majority of you think, yes, she sounds like she's really ready to try something new, to get unstuck here. Only 3 people said, but I wanted her to be a dancer. So it's funny because I've used this question before with this clip. And sometimes a lot of people say, well, I wanted her to be a dancer. And I love that in a way, because it shows how easily we invest in other people and in their outcomes. This is not someone you've ever met. You've heard her talking on a webinar for a couple minutes now. And yet sometimes it can be hard to accept when someone wants to do something that wasn't your initial idea for them, right? And when it's your own kid, your own partner, your own sibling, it's only a million times harder, right? Because we all get invested in certain outcomes that we want to see for people. And it happens to therapists too. You've seen other clients succeed by doing a certain thing, and therefore you want this patient to do that, but they want to do it a different way. And it can be hard to let go of your own vision. And I think that even comes up sometimes when people are listening to this clip. So as you heard, though, it was a lovely conversation. It was light, it was conversational. There was no strain to it. They both sounded genuinely happy to be having it, like the tone was nice. And Simone did come away feeling like, hey, that was genuinely helpful. And again, I've listened to Simone have this conversation with a lot of people, and she almost never says that. So she really must have meant it. The parent did a great job reflecting key points and values, asking a couple of open-ended questions, and just being very positive and having confidence in Simone as she says, hey, I think I'm gonna pursue this idea. The parent says, wait, but I thought you were gonna go dancing, or are you sure you really want to do kickboxing? I don't know if that's right for you. She's very positive. She shows that she really believes in her. So that's kind of some of the basic ideas of motivational interviewing for loved ones. And what I'm going to kind of transition to now is telling you a little bit about the research that I've done and present some of the results of studies, some of which are ongoing. So I would say these are interim results. So we've tested this content in 2 different formats, group and individual. I call the group format the School of Hard Talks. It's 8 hours of content. And in our pilot study, we did it across 4 sessions, so 4 2-hour sessions. And we had 6 to 10 parents per group. We have another study that offers one-on-one coaching with 4 hours of content and an optional 5th hour just for problem solving and support. And this study is specifically for parents of individuals with psychosis that's more recent onset, so past 5 years since the illness started. That study is actually still enrolling. So, and I shouldn't have the word parents here, it's really loved ones. So if you have someone in your life who is experiencing psychosis and you'd like to get this coaching for free, in being part of a study, I'll give you the contact information to get in touch. The School of Hard Talks right now has kind of moved past the research phase, and we're now starting to implement that in the community. So I'm going to tell you a little bit more about the results from the group format, the School of Hard Talks, but it's really pretty much the same content. So we had some pilot research questions when we developed this curriculum. Again, it was 8 hours of curriculum, and we were going to offer it to specifically parents of teens and young adults with any kind of concern about their child's mental health, substance use, or behavior. So really casting a wide net. And let me go back to sharing my screen here so you can see the details. Okay, to lots of different parents. So our pilot questions were, would caregivers even be interested in that? We were supposed to start in March 2020, and we all know how that went. So we had to sort of redesign it for a virtual setting. So is it feasible using remote technology? Can the program help parents feel less stressed and better about themselves? Can we help families have less conflict and more fun? And we also wanted to know how long, if we make a difference, how long does that difference last? You know, does it go away after a week or 2 weeks? You know, maybe you feel better coming out of the class, you feel like, okay, I've got this, but the next day it kind of falls apart. So our format was, again, an 8-hour group, which we broke into 2-hour chunks with 6 to 10 participants per group. There would be a main facilitator and a co-facilitator. So, So the main facilitators were myself and Dr. Sean Davis, who was a fellow at Harvard, is now an assistant professor at University of Maryland. And co-facilitators, these are my other colleagues, Teresa McIntyre and Heather Thibault. And Heather really did an amazing job with kind of onboarding everybody so that they knew how to use, you know, this was when Zoom was brand new. We started. By the end, she didn't have to explain Zoom to anybody anymore. But, you know, how to join the group, what to expect, all of that. Oh, and I just want to add one more thing about Teresa, one of the co-developers and co-facilitators of this curriculum. Teresa is what we call in Massachusetts a parent partner. So that means that she helps to direct programming and offers support to parents using her own experience as a parent to inform those efforts. And that will come up again in a few minutes. So I want to tell you a little bit about the qualitative outcomes, about what did participants learn from the School of Hard Talks and whether they were able to master the skills that we taught, which we evaluated using the real plays. And with quantitative outcomes, I was looking for, you know, did people stick with it? Did they attend all 8 hours? And we gave them surveys measuring their stress, their confidence, their conflict in their family, and sort of their level of resentment or hostility that they were feeling about their caregiver role. Before participating in the training, they did these surveys. They did them again after participating in the training. And then we followed up with people several months later, 3 months later, and did the same surveys again to see whether the impact had lasted. So this was in clinical trials, what's called an open label study. So everybody got the intervention. We didn't randomize people to control versus intervention. I think that's in the works for sort of the next round. But what we did was we assigned everybody to a group, and we measured those areas of interest before, after, and 3 months later. And again, we cast a very broad net. It was open to any caregivers of youth ages 14 to 24 with mental health concerns. And in this pilot feasibility sample, we enrolled 62 parents during basically the second half of 2020. So of those 62 people, 61 gave us information about themselves. They did a baseline assessment. And 12 people, sorry, altogether of the 62 did drop out before attending any of the sessions. So some people ended up going, oh, you know what, this actually doesn't work for my schedule. See you later, fine. Of the 49 who ended up attending at least one of the, 49 who ended up attending at least 1 hour, everybody actually did at least 5 hours. So nobody dropped out after 1 hour, 2 hours, 3 hours, or 4 hours. So people are really stuck in there. Most people did all 8 hours. 49 completed their post-intervention assessments. Excuse me. And we were able to track down 41 of them 12 weeks later for another assessment. Here's a little bit of information about our participants. Most were women. About half and half said that they were parenting with another adult in the house, half were single. Most were white, and their average age was 53, though we did have a broad range of ages, 34 to 77. 92% of them, the vast majority, lived with their child while they participated in this program. And about half have reported that their child had had at least one night in the hospital due to psychiatric concerns. A third of our parents were involved with what we call the Department of Mental Health in Massachusetts, excuse me, which represents a higher level of services. So here's what parents said when we asked them 12 weeks after they did the course. What's the most important change you've noticed since you attended the School of Hard Knocks? One parent, I pulled out just a few responses that I thought were interesting. And again, I'm losing my voice here. I'm not used to talking for a full hour straight. So bear with me. All right, so one parent said, the children are willing to listen to me and not just dismiss what I'm saying. Another person said, conversations are not as intense or volatile. I've incorporated skills that help me cope and thus help my children. Another parent said very specifically, I find that I'm holding back on criticizing my child for her decisions. And instead I try to find out from her what her motivations are by asking curious questions rather than judging. And another parent said, I think I have more productive discussions with my children, and that makes me feel better about myself and as a parent. And I also find that I'm very annoyed with my spouse who doesn't know any motivational interviewing techniques or use them when talking with me or our kids. So those are some of the qualitative results. It's also really fun to listen as I shared with you the before and after real plays to see how people were able to kind of learn some of these new skills and try them out. We don't know if they were able to try them at home, though they told us they were, but they definitely did a good job with my staff. In terms of the quantitative results, here's kind of those four areas that I mentioned I was interested in. Expressed emotion, which is like that kind of resentment of your caregiver role. It's a weird term, but that's what it means. Confidence in your parenting, stress, just overall in your life, and conflict that you're experiencing as a family. And what we saw were significant and large decreases in expressed emotion, confidence, and stress from the pre to the post measurement time point. And then we see very little rebound at 12 weeks. So again, there was no control group for this study. So this may have all just been due to like the randomness of people's life situations getting better, getting worse, getting better, getting worse. But when you see this big change from pre to post and then very little change afterwards, it gives you a little bit more confidence, even without a control group, that what you're seeing may be due to the intervention itself. And it's also good news because it looks like from post to follow-up, people don't go back to their prior level of stress, for example, or they don't fall back to their prior level of confidence. They're able to maintain that better feeling that they're having. With conflict, again, all these are statistically significant differences, but it's a little bit of a different pattern. What we see is a big drop from pre to post, but then that drop continues at follow-up. So again, this could be that people enrolled during a crisis point and things were going to get better no matter what. And that didn't really have anything to do with my program. But I like to think in combination with these other sources of evidence that we can speculate that their family conflict did go down as a result of participating in the program, and that actually having less conflict led to less conflict, and that change continued in a positive direction, even 12 weeks after our intervention ended. So here's some sample items of what I'm talking about when I talk about these concepts on the expressed emotion scale. That's kind of that resentment. about everything you have to do as a caregiver. So a sample item is, my child does not appreciate everything I do for them. And people say, you know, whether they disagree or agree. For the stress questionnaire, a sample item is, in the last month, how often have you felt that you were able to control the important things in your life? For that confidence questionnaire, we had people say how much they agreed with statements like, I think I'm doing a good job as a parent. And for that conflict questionnaire, we had them say how much they agree or disagree with statements like, for the most part, my child likes to talk to me. So that's just gives you a little flavor of what that's about. So people always have questions about expressed emotion. So I'll talk a little bit more about that. It's something that there's been a lot of research into this concept, and I don't know why it's called expressed emotion. I really can't explain that. But it's interesting because it is kind of a strong predictor of youth mental health outcomes. So what people find is that in across a lot of different diagnoses, it's never a parent's fault that a child is having a mental health problem, but that kids who live in an environment that has a lot of expressed emotion are likely to have more persistent issues. The issues are less likely to get better on their own. Expressed emotion has kind of two facets to it. One is like that emotional overinvolvement, what people call helicoptering, like, let me do all that for you, let me kind of micromanage. And criticism, so being openly critical of another person. Here's how I like to think about expressed emotion and its relationship to motivational interviewing and these skills. If we think about relationships, especially family relationships, along these kind of two axes, we have like one kind of spectrum of like non-judgmental to critical, right? Those are opposites. And then another axis of parents who are way over involved versus parents who really support autonomy. Those are also opposites. So parents who are over involved and critical might be considered high in that expressed emotion. Parents who are very involved and non-judgmental might be like best friends with their kids, right? Parents who are critical but more supporting of autonomy might be kind of my way or the highway parents, like my rules are get out of my house. And parents who are more non-judgmental but supporting autonomy may be kind of using an MI type philosophy. And I just want to emphasize that like most of what we do as parents is like fine. You know what I mean? Like it's not, the stakes are not that high minute to minute, but we know that when our kids are struggling, it's really, really hard. And that's when these kind of micro decisions become important. And it can be really helpful to get some help in terms of getting to a place of sort of non-judgment, supporting autonomy. If you're in it, if you see yourself in another quadrant here and it's working for you, good for you. That is fine. I'm not here to challenge that. That's a-okay. So I'll talk about, you know, sort of that some of the research is ongoing. Again, you can still enroll for the one-on-one Milo coaching. It's all virtual. The study is being done out of Boston University, and we're still enrolling for a few more weeks. So if you have a family member with psychosis that started in the last 5 years, you're eligible to participate in that. But the pilot study for the group is wrapped up. And I think what we have concluded is that this content really helped people to manage their role as caregivers, and that people were able to really use and demonstrate those basic skills of reflections, open-ended questions, and a couple of other skills that we go over in the course. The other thing that's been really clear to me as I've done this work is just the interest has been high, right? And what I've heard over and over again from parents is that their child may be ambivalent about being involved with mental health services, but the parents are not. Parents are definitely looking for help. And so as a clinic leader and as a psychologist, I really feel like how can I, and in my role, and encourage my colleagues to be more creative about finding ways to support the people who are motivated, even when the person at the center of concern is not sure. So I'm going to give you a few more polls just to see if I've done a good job of giving my presentation. And I'll give you a couple more resources, and then we can have lots of time for questions. So I'm going to launch a poll. It has 3 questions. Go ahead and let me know what you think. All right, I see a lot of answers rolling in. Thank you all for doing the poll. I'll give you a couple more seconds. So just to go over it, insight is awareness of one's illness, and it is also changeable, right? So we can move up and down in our insight. And I recommend that if you're talking with your relative who has poor insight, you might get further with them by expressing some curiosity and interest in their perspective before giving your own advice. Again, I think that your involvement in their lives is incredibly important. And I would never say, stop being involved or stop giving advice. Everybody's situation is different, but in general, we know that people whose families are involved with them tend to have better outcomes in chronic psychiatric disorders. But you might hold up back on your advice until you have asked them more about their own situation and help them to really feel that sense of being understood, confident, and in control. Yes, and I see a suggestion that I absolutely agree with in the chat, that it can really help to ask permission before giving advice. That's something that we also describe in the course. So I'm going to share my screen again and give a couple more tips and resources. Okay, so again, for the Milo coaching study, last chance to enroll over the next few weeks. I'm going to put the information for getting in touch up on the screen. At the same time, I'm working with the Department of Mental Health with about 40 parent partners. So parents who routinely offer support groups and counseling to other parents. They're learning the School of Hard Talks curriculum, and they're going to implement that in their settings. They work around the state in lots of different settings. And so we're going to kind of do this experiment together. Well, I'll give them the curriculum, teach them how to do it, and they'll let me know if they're able to implement it and how that goes. So that's really exciting. I also want to tell you about, this is a resource I'm really excited about. It's called the School of Hard Talks Online. Claire is going to send out a link to it after this event. And it's an online course that is totally free. It was funded, it's on a Massachusetts Department of Mental Health website. It was funded by the State Department of Mental Health. And basically, I worked with a curriculum designer to try and put all this content into an interactive e-course. Some other resources I really recommend are Javier Amador's book, I'm Not Sick, I Don't Need Help. I think, the LEAP method is, I haven't taken his course. I've read the book and I think it's excellent. I think it's really very, very similar to MI. I think MI is more granular, like it gives you really concrete things to say. So I find that incredibly helpful in addition to that book. You can also read sort of the textbook on motivational interviewing that therapists all read in graduate school. It's meant for therapists and clinicians, but there's no reason that anybody couldn't read it. I think it's a great book. It's called Motivational Interviewing. And if you're curious about a little more of my perspective, I also wrote a NAMI blog last year about talking about psychiatric medications with your kids. So if you go to the NAMI website, and I don't know, if you search for my name, you can probably pull it up. If you're interested in the Milo study, or you want the link to the School of Hard Talks online, you can go to this website and get in touch with Heather Thibault, who's the study coordinator for that study. That's her number. So she checks that between 9 and 5. She's super responsive. She'll get right back to you. If you're not sure if you're eligible, you can still get in touch with her. As I mentioned before, when I was presenting some of my results, most of our participants to this point have been white, non-Hispanic. So if you might be eligible and you have a different background, I'd love to hear from you, just to get a sense of how this material lands with different groups and make sure that we're being inclusive in our research and getting lots of different perspectives. So again, if you want to read more about the study, you can go to this website or just give Heather a text or a call, and she'll get back to you. You can think it through together. All right, well, that's all my content. So it looks like we have like 15, 20 minutes for questions.
Can you just confirm, so there were a couple of questions about enrolling in the study. So this, the contact person that's up right now, that's the person to get in touch with if you are interested in enrolling. Is that correct?
That's correct, yes.
Awesome. Great. Well, that was several of the questions. But there are a number of other questions as well. So one is there any access to coaching around Milo outside of these studies? Can you speak a little bit about any resources that might be available for that?
So I know I'm talking with New Yorkers here, but there might be some people on the call from Massachusetts. If you live in Massachusetts, you can access one of these parent support groups that's going to be implementing the curriculum. They're usually parent partner led, and they're just getting off the ground. So a lot of them have the goal of getting started with their Milo groups around January, because they're just in training now. So if you're in Massachusetts, get in touch. I can connect you to a good facilitator who's getting a group off the ground. If you are not, basically I recommend the e-course for now, because that's what I have to offer. You know, you can also do one of the cool things about motivational interviewing is that anyone can get trained. So you don't have to be like a clinical social worker, a psychologist, or a nurse. You don't have to have any particular credential to enroll in a motivational interviewing course. Now, a lot of what you learn will feel very clinical. It won't feel like something that you could necessarily take home and use with your family, right? Because it's being taught to clinicians for a clinical context. But there's nothing stopping you from doing it. You could find a motivational interviewing course and do it. But if you are interested, in sort of the translation for families, I definitely recommend the e-course, which Claire is going to send out the link. And it's also linked from my website, learnaboutmilo.com.
Awesome. So there were several questions about applying this in different contexts. So I'm going to go through a couple of those. How would you use this method whose thought system includes bizarre prejudices and beliefs, which might be offensive?
That stuff can be really hard to hear. I mean, I just want to offer that because I know it's real, and I don't want to sugarcoat it. A lot of you are probably dealing with situations that are bizarre, longstanding, stuff that's been going on for a long time, and maybe volatile and maybe offensive too, and I don't have a magic wand to wave. And I just want to say, I admire your, the sense of hope that brings you to a webinar like this, if you're dealing with something that's been going on a long time. So I think, part of what I might be hearing in that question though, is like, is it okay to be curious about or express a reflection about something that is abhorrent to you? And that can feel really dicey to people. I generally feel like expressing curiosity is like a value that I have, that sort of you can't go wrong saying, help me understand that, or tell me more about where you're coming from. And, it can be a safe space for you and your loved one to talk about whatever they think. You're not co-signing their belief by being curious about it. You're not even co-signing their belief by offering a reflection. If you want to put some space between you and that belief, you can say, so it sounds like you're saying the reflection, right? And that puts a little bit of space between you and that belief. But it's okay to reflect and try and express understanding to someone, even who, if that belief is horrifying to you. You can always later in the conversation say, well, I have a different perspective. Can I share that? And they might say yes or no. But the idea of motivational interviewing also is that it's not really a magic wand. It's a different approach. It's a way to build relationship, right? So that even if this time you're not successful in sort of convincing that person that they're wrong, you have a stronger relationship. And every time you do that, you're getting sort of the foundation of that relationship with that person stronger and stronger, so that they might be more and more interested in your perspective next time, right? Because usually probably nobody listens to them. So that's kind of the hope. I also like to think about research from the couples therapy world, where, in order to have a good marriage, they say you need a ratio of 4-to-1. That's 4 positive or neutral interactions for every bad one, right? So a neutral or positive interaction can be like, pass me the milk, thanks. Or it can be something like, wow, you're such a great partner. I really appreciate how you always, do this or that. But it could be pretty simple, and I think that ratio is probably true of lots of different relationships in our lives. So even with your kids, if somebody's expressing views that are so hard to hear, probably most of your interactions with them are fairly negative, right? Because you don't want to hear that. And I totally get that. It's really, really tough. But expressing a little bit of curiosity, it puts money in the right side of that bank, right? So you have more to draw out later. So it's a long answer to that question, but I hope it's helpful.
Yeah, absolutely. There's another question. No, I think that does address the question. There was another similar question, which may be able to elaborate more about. How would you address an individual who's saying he wants to do something destructive?
Yeah, I think it's a fine line, right? Because I don't think there's I sometimes when I'm working with families, I learn that there's violence going on in the home, right? And it's usually not the first thing people will tell you, but it's very, very common, unfortunately. And, it's never somebody's fault if they're being victimized by someone in their home who's violent or someone in their family who's violent. At the same time, words are words and they are different from actions. I think one way if you're hearing somebody say that they're very angry, they want to do something destructive, even if it's coming out as bizarre, you can do a reflection either of the content or take a guess at the feelings underneath. So if somebody's like, I'm going to burn down that hospital, I hate those people, you can say, wow, you're really angry at your doctors. That would be a reflection for that statement, right? You don't have to go into like, the actual like, wow, are you really going to be an arsonist here? But to offer a reflection of how they're feeling, like, wow, I'm hearing a lot of anger. You must be super frustrated. It sucks how mistreated you felt over so long. Those are all good things to say. And they're all nice reflections that can really help cool down the temperature when someone's feeling really upset.
There were a couple of questions about, several people mentioned that they were interested in applying this within relationships with their parents or with spouses. Can you talk a little bit, and someone specifically mentioned spouse, can you talk a little bit about any changes that might apply if someone is applying these techniques in relationships other than one where they're the parent and they're speaking to their child?
That's a really good question. No, think about that. So I think one thing that probably would be more important in that situation is to be more transparent about what you're doing. And it can help with your kids too, by the way. But, if all of a sudden, your spouse might find it manipulative, that all of a sudden you're speaking in a different way. So being really transparent, like I took this course on communication, I'm going to try the skills that I used. I think would be important in that situation, just to be upfront about, that you're doing something new. And hopefully in a way that is honoring them, right? Like that makes them feel important. Like, I want our relationship to be better. I love you. I value you. I'm going to try out some new and possibly very awkward communication skills. And you'll probably notice it, but just roll with it. Okay. Like, can you just let me try and respond authentically? I will also just disclose that like my husband was the guinea pig for a lot of my content. So he knows, like he would like be like, oh, you're doing your thing on me. And eventually came to see it as just like kind of a nice way to communicate, and is as good at the skills as anyone now, because he's heard me do it so many times and he uses it on me too. So I think when you're being transparent about this, it isn't necessarily like manipulative or condescending or anything like that. It can just be a nice and respectful way to communicate, especially when someone's having a problem.
Great. There's one specific situation that I think could be illuminating to address. What do you do if your loved one says 100% of the time, I don't want to talk about it? Is there a way to apply these techniques in that case?
Well, you can always do a reflection. You don't want me in your business. You wish I'd back off. And just as an experiment, they might just say, yeah, and walk away. But you could try it and let me know how it goes. Another question you could ask is like, is there something that you don't want, can you help me understand, like, have I done something that makes you uncomfortable talking with me? Like, ask an open-ended question about why they don't want to talk about it, without being annoying, like, well, why? Just tell me why. But really a curious question, like, what are you worried about? What do you think might happen if you tell me? If I understand that, like, I can be better. If you don't want advice, I won't give advice. Or if you're worried that I'll think you're a terrible person, like, I won't. I love you. I won't. You can tell me. and try and maybe understand a little bit of the reasons that they're so guarded. But again, when you're dealing with someone who is in an acute phase of mental illness, sometimes they're guarded because they're guarded and they're just very, very paranoid. And there's no magic wand for that. And I do know that, after doing this work for a couple of years and doing these studies and, talking with all these parents who've participated in the studies, one thing it's really interesting working with the caregivers and siblings of people with really acute illness, like people who are really in a bad stage, because they often really appreciate, they're among the most appreciative of the skills in the sessions, but they're also kind of the least able to go home and plug it in. There's just so much going on and it's so hard. And I have learned that. And so I just have a lot of humility around that. There's no magic here.
There's another question sort of about, which I think is an interesting question. You talked about autonomy. One person asked, when your child has mental illness, it's so hard to expect autonomy, isn't it? And I'm wondering if you can speak to that response a little bit.
It's been very interesting for me because I for whatever reason, maybe had the bias going into this work that people want more autonomy and like caregivers are trying to like keep things under their control, and that the identified patient is the one trying to get autonomy. But I've been corrected a lot of the time that sometimes people, really want, it's really the other way around. Like the parents wish that their kids could be more autonomous, and yet the kids are unable to do things for themselves or pull for a lot of assistance with everything. So I think it can work both ways, but I think that finding little ways to support autonomy can be helpful. So like the parent did in that audio clip, just, she wasn't making any assumptions about whether Simone was able to get to a dance class tomorrow or whatever. She just said, well, what could you do? It was just a little subtle gesture of promoting her autonomy and saying like, well, I think, I'm curious what you think you could do. So I think, without getting into the weeds of like, is it, sort of the logistics, because I know that it's really complicated when people have serious mental illness, they often can't do a lot of things for themselves. And you can't expect that as the person wrote. But, in conversation, you can pull for autonomy or cast your weight on the side of autonomy just by asking questions like, well, what do you think? What do you want to do about it? How do you want to handle it? And push gently in that direction.
Yeah, for sure. There was a question a little ways up in the chat, and then I think if there are any more questions, please feel free to put them in the chat. But there was a question about sort of toxic positivity and motivational interviewing, and how to keep from going into sort of toxic positivity within this context.
Oh yeah, I saw that comment and I was hoping we would get to it because I like that. So toxic positivity, as I understand it, I think it means like being sort of relentlessly positive about everything. Like, oh, my grandfather died. Well, he lived a great life, instead of sort of allowing that person to be, to feel their grief, to sort of insist on positivity in every moment. So I actually think motivational interviewing is a great correction to toxic positivity, because it's about not pushing for solutions all the time. It's about listening and kind of trying to understand why someone feels the way they feel, what's going on with them. And it can be very, very uncomfortable it's even uncomfortable. I supervise a lot of trainee therapists. It's uncomfortable for them sometimes. They say, well, I'm not doing anything. I'm just letting this person vent. And I often challenge them on that. I'm thinking, well, I don't think you're just letting them vent. I hear you describing a lot of great therapeutic tools you're using with that client. And among them is allowing them to vent, right? And not insisting that they find a solution for their problem right now, or that they stop feeling frustrated or sad or anxious right now. Because it's not helpful to sort of insist on positivity all the time.
Definitely. Couple sort of shorter questions. Is there a difference between anosognosia and the lack of insight?
I hope I'm not wrong, but my understanding is that anosognosia is a fancy word for lack of insight.
That's my understanding as well. So you're not the only one. And a question about the study. Where was it? No, were the parents in the study compensated for their participation? Can you talk about that?
They were compensated for filling out my questionnaires, not for attending any of the groups or coaching sessions. So, that was just what we were offering as part of the study. If they were willing to fill out the questionnaires, then we would compensate them $25 for their time. Yeah.
There was a question, there was a paper that you referenced that NAMI has. I'm wondering if that's the blog post that you.
That's blog post, yeah.
Okay, great. Yeah, we don't have the link for that handy, but we can include that in the email that we send out for folks. There's also a question. So there are two questions, and we're running right up against the end of our time. But there are some questions about asking folks to take care of specific household and hygiene tasks, which I think kind of all go together. And so I'm going to ask you to speak to those, and then we're gonna wrap up with our program. So the first one is, how do you encourage a spouse to independently take care of hygiene tasks like taking a shower? And then the question that went with that is, how can you encourage an adult to step up to chores and household cleaning when they have a lot of anxiety and aversion to it?
Oh, that's a lot to cover in a minute.
You can take your time.
Yeah. I think that starting a conversation, starting a hard talk with the phrase "I've noticed" can always be just a helpful icebreaker to make a really straightforward observation about a behavior. Like, I've noticed that you haven't showered the past few days, and just see what they say. A great question that I love to use is, what's getting in the way? It's a very non-judgmental question. It's open-ended. It's a winner in my book. Ask what's getting in the way. So that's one suggestion. The cleaning, I'm usually talking to parents of younger people who just don't clean because they don't clean. That's interesting that, this one of the attendees here is that there's a specific struggle going on with anxiety around cleaning and maybe some phobias or things like that. That's really hard. But I think, trying to be brave and have a open conversation when you're up for it. It could help, as some questions I might suggest asking would be like, what chores do you feel like you could take on? Or, what's getting in the way? Or one that one of the parents I worked with she was a nurse, and she would get home from these long emergency room shifts, and her kids were like playing video games in the kitchen, would always be a wreck. And it was just like a terrible situation, you know, would just start off the evening completely terribly every day. To encounter this over and over again. And she had some success with the question. She would go over to her daughters and say, oh, I see you're playing video games. Can you tell me what you're playing? She would express an interest in it, be positive about it, and then say, when would be a good time to take a break and do the dishes? And she said it was like beautiful results. So that's one suggestion from a parent who I worked with around the chores as well.
All right, we're a little bit over, so we're going to wrap it up there. I know that there were some last kind of questions trickling in, and I'm sorry that we don't have time to address all of them. I put my email address in the chat earlier, but I'm going to say that out again. So if anybody wants to get in touch or has any follow-up questions, you can reach out to me. You can also reply to the email that you will receive in the next day or two with the further resources and the links to the slides, both in English and Spanish. So my email, if you want to reach out, is CKIELY@NAMI-NYC.org. And I'm going to put that in the chat as well. So thank you everyone so much for joining us this evening. Thank you so much to our interpreters, our ASL and Spanish interpreters. We really appreciate your work, and I hope that it was useful to some folks that were joining us today. With that, we're gonna close out. Thank you so much for being here. Thank you to our presenter, Dr. Klein, and we appreciate all of your kind words and good wishes. And your being here today and your participation in the chat and with the questions and in the polls. It really does help make this more engaging and more of a community event. So thank you all so much. Please, you can feel free to save the chat if you would like. You can click the 3 dots at the bottom right-hand corner of the screen above the chat box. But everything all the links that have been shared there will be shared in the email after the event as well. So thank you everyone, and good night.
Good night.